So with bronchiolitis kids, and then especially asthmatics, if they're on a high flow system, we can do a nebulizer in line. So typically there's two pieces. You've got this T and then this cup, and the cup has the cord that clips in like this. And just to demonstrate, if this was your unit dose, you would just go ahead and put this in. And then when you turn it on, you can go ahead and see the mist in there. So that's what you're looking for to make sure that it's working. Occasionally, just because of the wear and tear on these cords sometimes don't work. So if you have like a yellow light on this one here, then it's showing you that something's wrong. So it can either be here, it could be within the cup, but that's what you're looking for to make sure that it's being used correctly. So to put it in line, it doesn't just fit on here because of this ring right here, so it's not going to connect. In order to do that, you have to put this piece on, and it's kind of a tough, and trying to do it while it's on a patient is sometimes a harder issue. But it'll end up popping on like this. And so it should always be on the dry side of the heater. So it's gonna be going into the heater and coming back out. If you come through here, then you're getting all of that humidity drawn in with it. And so it would go ahead and sit like this. And what we've kind of decided is, because respiratory has different areas that we're covering, sometimes we're not always able to get up like instantaneously. If you can call your RT and they're not available, then try their charge therapist, and you can reach them by just calling RT charge. If they're unable to go ahead and get up here, then you guys could go ahead and do the neb for us, at least until we can get up here. So making sure that you put in the respiratory vitals, all that type of stuff. But all you would do would just scan your meds and then go ahead and give the neb. It's delivered directly through the nasal cannula, so the kids tend to do a little bit better with it because they aren't even aware that they're getting it. Anything else on that?
What would you do for setup if it was not in high flow and you just had the wall?
So we have like a handheld Aerogen, and you end up just using this piece, and it connects into like a handheld thing. The same type of thing, this attaches here. You're gonna push the blue button in order to get the neb to deliver. Usually with that one, there's a oxygen tubing that comes with it. You only need to use it about 2 liters of flow, which is just enough to push the meds up for the kid to breathe in. If they're old enough, you can use a mouthpiece, but if not, you can do a mask with that too. The mask doesn't fit on real well with that system, so making sure that you kind of keep an eye on that. If the kids don't want you to do it, one good thing is to give it to the parents, so that way the parents can go ahead and deliver it, and then just kind of keep an eye on them that way. But you're looking for that constant stream of meds. When you no longer see that in the cup here, then you know that all your meds have been delivered.
And if you are the one doing the neb, make sure that you do a pre-score and a post-score of the PAS, the Pediatric Asthma Score. And that's all in the RESP scoring flow sheet. So you want to do on pre and post in the same column, just so that it shows the benefit or lack of benefit.
You have to have something that you're comparing it to. One of the things on there is making sure you get a room air saturation, so we will do that. And the score for the third is for a 3 is they're less than 85. So once they hit below 85, I turn the oxygen back on. I don't care how low they go. I just know that they're not ready to come off it as of yet.
Sounds great. Thank you, Sherry.
You're welcome.